Welcome back. What a discussion we're having in studio, on air and off air. The way forward for the country, moment of decision, rising COVID-19 numbers, struggling economy, concerns in the education sector, and that political class. Defiant, I think, is one word to use to describe them. We have the experts in studio and virtual to have this discussion. Wilson Sosion, SecGen of NAT, and Chibanzi Mwachonda, SecGen of KMPDU, here with me in studio. And joining us virtually is Sylvia Kasanga, nominated Senator, Chair of the Ad Hoc Committee on the COVID-19 situation in Kenya. She says they are winding up their work. And Janet Ouko, an education expert. Sosion, before I come to you, let me hear from Janet. We had 6 months to implement all the things that Chibanzi is talking about when it comes to the education sector, ensuring there is infrastructure in schools, linking every school with a medical facility, having protocols very clear so that everybody knows what to do, even figuring out how day scholars will safely go to school and come back home. But clearly, we did not meet that target. Do you expect to see any rapid action in the next month or so? Or are we stuck in this rut?
I do not expect to see anything, especially now because our focus as a country has moved on to BBI. And it's really unfortunate to have a government such as ours, because every Kenyan has got a right to complain today. We began by saying that this is a global problem. How are other nations performing? How are other nations doing? I mean, our neighbors are open fully. So why are we partially open and we are having all these problems? We have an indisciplined problem as a country. We have a leadership that is not focused on what it is supposed to be doing. It has lost focus entirely. And we are not, we had 7 months, Waihiga. We did not put in place what we were supposed to do. So Sion has just admitted today that primary schools did not receive 1 shilling. And when I said here a few weeks ago that the burden of fighting COVID and controlling COVID at school level has been left to parents, a lot of who really, especially I'm speaking about here in Nairobi, I know when you're telling a parent in Kibra or Mathare that masks and so on. So there are so many trade-offs that household is likely to do. And therefore, the government today, I'm really keen to listen at what the president is going to tell this country today, because he has got no control absolutely on the COVID situation at school level. He did not send money to the schools. And even the 500 that was supposed to be sent to the secondary school, Sosion can confirm here today that it hit schools almost a week after. I'm not even very sure that that money has hit schools, but by the time schools were opening, that money was not there, despite us spending 7 whole months studying and really looking at, do we want to open? And finally, when these results are being read, can we also introduce, when the Ministry of Health is reading out whatever is happening about COVID and the press conferences and all that, can we also start seeing what is happening at school level? Because I would want parents to really get to some assurances. I think as at November 1st, under 19 infections were accounting for only 9%. And considering that under 19s could probably account to about 50% of the total population in the country. So you can see what the research and the evidence has been telling us, that children are not the super spreaders. And the super spreaders are known. They are the bars which government did not hesitate to open. They are the marketplaces. They are political rallies. Those ones are open. Why are we not considering schools as an essential service that requires protection for all of us? And what is the business of a president that does not protect his children? We're talking about 17 million children. If 17 million children really is not something that can appeal to the president to really take decisions and to lead this country to a situation where we want to protect our parents, I am lost today as a citizen of Kenya. So, Sion, you want to respond to that?
Yeah, well,
she has quoted you quite a bit in her...
Yeah, of course. When we were preparing for the first phase of reopening, we were indeed extremely flexible, and we extended all the necessary support because we wanted to see how the PPEs, the infrastructure for enforcing the protocol measures have been put in place, availability of water, availability of sanitizers, availability of masks, and also implementation of the programs, establishment of the COVID-19 committees. But I think what is coming out at the moment is it's a very sad situation, because one, the funding that was supposed to be sent by government was either not sent on time, for example, the 500 shillings for secondary schools, of which the principals are saying it is inadequate. They cannot be able to sustain the services to the learners and also the services to the teachers. And the primary schools, they're not given even a single cent. We can return the fact and report that even some of the schools, washing hands, sanitizing is not possible in primary schools. And therefore, we can imagine a situation where now we insist in recalling all the other learners. That is the global practice. And it has been decided by many countries that are engaging in lockdown, that schools are essential services and learners must be facilitated to go to schools and back. In some African countries, the available resources within government were actually put into proper use. And government is able to provide masks, is able to provide sanitizers, and that is why learners are able to go to school and we have less issues. I think we did it upside down here in this country, that we opened the bars, we allowed funerals with higher numbers, and then we spoiled it by allowing high voltage political rallies. I had an opportunity to attend an event that I expected to be not more than 100, but I found a crowd of close to 2,000, and none of the participants had a mask. There was no social distancing.
Including yourself?
No, I had a mask, and I've always put on a mask, and I've always ensured, wherever I sit, I ensure these measures are implemented. These protocol measures that the government pronounces are never implemented. And therefore, the threat to our children is the community and poor enforcement by government.
You sit in Parliament. Why do you
Parliament does not enforce?
That's okay. Why do you think these measures are not implemented? Why do you think money
hasn't
been wired to schools on time? Why?
Let's go out of the COVID and look at many things, even legislation in this country. We have very good laws, but they are not implemented. And so that laxity of poor implementation of programs, poor enforcement, has been transferred to the school system.
Okay.
And 3 weeks down the line after reopening, I think we have to engage in a seriously deeper reflection. And the doctors have spoken. And they've given us the clear guidelines. We must ensure that children are protected right from home to schools in terms of transport, how they move, and we must ensure that schools are safe. And indeed, for the last 3 weeks, we've experienced that children are safer in school because teachers have had to take a lot of time to teach children on simple safety protocol measures on COVID, meaning they were not taught. There was no enforcement.
I don't know if you can tell the parents of the Kolanya students that their children are really safer. Is that a fair
community? Of course, this fear we have to remove. And Kolanya and several other schools,
yes.
Tononoka, and medically speaking, you cannot send those children at home back to the community.
Okay.
And administratively speaking, the government must give it the topmost priority to check, test all the learners and isolate if it is necessary. They are supposed to be isolation-based within schools. And as the doctor has said, all schools should be linked to the health facilities. If a learner is sick, you don't send that learner back to the parents. You transmit that learner to the healthcare service network. And that is what needs to be done. So what we are insisting is that there must be evidence that every school is actually seriously, properly linked to a medical service provider. And schools that have reported such cases, there must be evidence that that matter has been addressed sufficiently by the healthcare system. The president is meeting with the governors.
Yes.
And we know the healthcare service is devolved. So really the governors have the biggest responsibility to help us and ensure that our schools are completely safe.
These are the same governors
once that is done, then we can guarantee then learners can come to school. Before that is done, then it will be a risky venture to release learners and leave them to the mercy of the progress of this disease, and we will witness more deaths. And these deaths are not affecting actually learners. It's affecting teachers.
Okay, thank you so much, Honorable
the majority of the teachers that we have are
Thank you, Honorable Sosion. Yes. And I know nobody wants more deaths. Let me allow Senator Kasanga to weigh in on this. Senator, as your committee carried out its work, what was the assessment of the education sector? Had you foreseen some of the challenges that we are seeing now? Is that something you looked at? First of all, maybe is where I should begin.
Yes, we did, Wahiga, we did have engagements with the Ministry of Education, and for us, it was a bit of a big disappointment. First, to get them to come to the meeting, to get the CS to come to the meeting was a challenge, and when he finally came, it was clear to us that they had no strategy whatsoever on how opening was going to be done at that time. And Wahiga, I think Honorable Sossion should also wear the cap of a member of parliament and also answer a couple of questions when it comes, especially to the fact that there is no money that has been paid to the schools to this time. I think that is a very frustrating issue, and that is an issue which we cannot deal with in Senate. Money issues are dealt with at National Assembly. So Honorable Sossion should tell us what he has done as a member of parliament to push the education ministry to make sure the money has gone down in good time towards opening, because I know he's been part and parcel of all the conversations that have been going on. He also came to our committee. I remember he appeared before our committee at that time when we were trying to establish what the ministry needs to do to prepare schools for reopening. So we have not had any other engagements with the Ministry of Education since that time, because there's always been an excuse as why not to come to the committee. So we've not been able to engage again beyond that first part of engagement, but it was very clear that they had no strategy at that time when we met them. And even now you can see these are the challenges. Why has the enforcement around the schools not been done on time? So again, where is the role of parliament when it comes to some of these things? By the way, parliament has a very big role to play. You would have expected by now the education committees have been putting pressure on government to make sure money has been sent down to the schools so that they can support schools reopening. That is a function of oversighting that parliament needs to do. So hopefully Honorable Sossion can also make a comment as a member of parliament on that issue, on what they have done. And secondly, Wahiga, I want to agree with what the doctor has said. We have to return back the curfews. We have to return back the containment measures, because clearly it looks like we cannot handle ourselves. We cannot take personal responsibility. And of course, let's not lose sight of the fact that the economy is also a challenge. Many Kenyans cannot afford those masks. What is government doing about providing masks at national level, at county government level? In fact, Wahiga, if you remember, at the conference that was there to do with COVID-19 that happened at KICC, we had government come and rate themselves, and they rated themselves quite highly when it came to the response of the pandemic. The government itself rated itself quite high. The county governments themselves, because they are represented in the national response team, also rated themselves fairly high. And I do remember categorically them talking about money not having been fully utilized. Where are these monies? Can these monies be sent then to schools to secure our students and teachers? And teachers are now frontline as well as all the other issues that were still pending. So there's still quite a lot of work there in between. But I largely agree with what the doctor is saying, that it's time now for us to see some more containment now being brought back, because clearly the community spread is going to be beyond what we can handle as a nation. Thank you, Wahiga.
Thank you so much for that. And you've posed some interesting questions to Sossion that I'll allow him to answer. But first, let me bring in Chibanzi Mwachonda, SecGen, KMPDU. And even as I do that, I had some SMS. Actually, let me read these tweets first. Willie Nyige is saying, yes, we want to fight the disease head on. The surge was expected when we opened the country. We have not taken the measures seriously, and now is the time. Atrash Mohammed, we have a serious problem in Kenya. The pandemic has really been an eye-opener. God have mercy. Checho Rono, teachers have also been interacting out there. They should also take precautions lest they carry these diseases back to school with them. Chibanzi, I don't know whether KMPDU has done some forecasting of what needs to be done now. How much time do we have to slow down this current surge? And if we don't, what could be the potential dangers moving forward? Do you have any predictions of what the next few weeks could look like, depending on the decisions that are made today?
Okay. First and foremost is to say that the situation we are in now is not going to be controlled even if we put in the containment measures and we bring back the strict.
So even if we had a complete lockdown today?
Even if you had a complete lockdown today, it will take up to 3 weeks to 4 weeks. Because over the last 2 months, we have seen very heightened political activity, large gatherings. We have seen funerals that are large numbers. No one has been taking the precautionary measures in place. So that means the spread has been going on, and you will continue. Remember, it's like a chain reaction. I get the disease, you get the disease. 14 days, 2 to 14 days incubation period. So if you're talking 2 to 14 days incubation period and you've had this large scale uncontrolled activity without adhering to any of the protocols, you're talking of up to a month before you can finally start seeing that now you're controlling this disease.
My goodness.
So the reality is that even if we lock down today, don't be surprised that you will still see infections rising, because this is not what it is a result of what has been happening over the last 3 to 4 weeks, and it takes a same period for you to start seeing a decline in infections. And that is why we are saying that a complete lockdown or even a lockdown is not going to help, because there is no single county in this country that does not have this disease. So the focus should be that in each and every county, depending on the disease burden, of course we have the high risk counties. In each of these counties, ensure that, one, you're limiting gatherings, you're limiting any enforcing the use of masks, you're making sure that you're limiting any super spreader event. As a result of that, the government also needs to ensure that masks are provided, especially like in Nairobi. I can tell you for a fact, in the slum areas, majority of these people, and which is the major population in Nairobi, they cannot afford these masks. So those are the places, those are the measures that we need to put in place, the curfews. That way, you will be limiting the spread in each county, because even movement, travel,
it's limited when you have a curfew.
Yes, it's
when
limited.
When should the
from
curfew
7.
kick in? Are you saying what, 7 p.m.?
7 p.m. That's what we're saying.
So meaning Kenyans leave their
where we were
places
initially
at 4 p.m.
Where we were initially by 7 p.m.
Meaning learners need to leave school latest by 4 p.m. Those who live far from their schools to get home.
Yes, it's better that way. It's better that way, and let learners have a very defined, well transport system to and from home, because that one means then they do not have to mingle with everyone else in the public.
Okay.
Yes.
If I don't give you a chance to speak again in 30 seconds, what would you say is your message to the president this morning?
One, the message is that yes, this is going to be a difficult decision, but the lives will now have to be more important than the livelihoods, especially because the lives that we are looking to lose are not just for the public, but the healthcare personnel who are the front line completely of handling this disease. And the rate of infections amongst healthcare workers is so high. And the decisions they make today, remember that we as healthcare workers are watching, because we are the ones bearing the greatest burden of this disease on the front lines. Make sure that your healthcare workers are well motivated, pay them, and ensure that the healthcare workers are willing and ready to go to work because of what the government is going to do for them. I think we've put in recommendations. We did a memorandum to the 5th Extraordinary Summit. Mm-hmm. All our recommendations are there. Those recommendations should be considered for the healthcare workers.
Okay, and Sossion, I'll come back to you shortly, but let me bring in Senator Kasanga just to wrap up with her. Senator, you've heard what Chibanzi has had to say. Even if we go into a complete lockdown today, you won't really see the kind of results we are looking for at least a month. If there ever was a moment for Solomonic wisdom, it would be today. In your view, what Solomonic wisdom should that be for the president, for the governors, for the Ministry of Health, as we look for a way out of this surging rise in the number of COVID-19 cases?
Largely, it's time to put aside our personal interests, because it looks like a lot of decisions that are made at such high levels are usually, led by personal decisions and personal interests. We need to put that aside now. And like Chibanzi is saying, we have to look at this country, we have to look at lives in a very different manner. We have to look at lives in a very different manner. And my understanding throughout my work now as an ad hoc committee chair and member is that as long as, this disease can get to anybody, anyone is affected, and nobody knows how badly affected you're going to get. So a lot of due care is required. A lot of wisdom is required right now by the president and his team.
Okay, we seem to have lost her. Apologies for that. But and as we wait to see if we'll get her back, Indimuhi Kahi, who is the chair of the Kenya Secondary School Heads Association, says this morning, we should not allow a medical challenge become an educational crisis in the county government. Okay, I'll read that shortly. I'm told we have a Senator back on. Senator, go ahead. Okay. We seem to have lost again. Let me read this. This is from Indimu Ikahi, who is the chairman, Kenya Secondary School Heads Association. We should not allow a medical challenge become an educational crisis in the country. Government must provide medical personnel and facilities in schools. Like Ghana, employed 3 medical officers per school. Issues of masks must be taken over by government. Some schools have had to provide this to students without a budget for it. Insurance of teachers. We have learned that insurance does not cover a pandemic. Teachers' insurance must be enhanced. So, Sion, let me get your thoughts on this even as we wrap this up. And, you know, just picking up off what you said a bit earlier on. You said when we reopened schools and allowed only a small group of students to report, this was for schools to test the infrastructure of COVID-19 preventive measures. This is causing quite a lot of reactions online because some are saying, were the Form 4s, Class 8 and Grade 4 guinea pigs?
They were not guinea pigs.
They are very concerned.
Not guinea pigs. And
it sounded like it from your statement.
And the guidelines from the World Health Organization was that you cannot open to schools with a bank. You open in phases. And therefore, we had to prioritize who are the first group of students. And from that first group, we'll be able to learn some lessons as we implement the protocol measures. And I think as a country, let us be honest. We've opened schools. We took a decision through the guidelines of the medical experts because of indication of flattening of the curve, and we were also very cautious. We did not open for all the learners, but now very clearly from the recommendation of Kahi Idimuli, it summarizes it all from the experience that even schools have had to use additional resources outside what had been provided by the government. Those are experiences, and that schools require even free medical personnel per school because of the crisis. Those are the experiences and lessons, and that government must take over the provision of masks. That was a contentious issue, and I've said it very clearly that learning from this, when government must really provide masks, and we've recommended at least R1 billion. Those are the simple calculations, because a mask, a quality mask that can take 6 months for a learner is 25 shillings. What is so difficult with availing this money and wiring them to schools? I think at this point we don't need to debate a lot about what has to be done. From the experiences, it is clear. Most of it rests with the government. And even as the government decides today, it must decide well. We want to hear that resources are being availed and schools are being made more secure in terms of connectivity to healthcare personnel, securing teachers, securing learners, and I think that's the direction we should go. It's not rocket science. It is simple logics. And in terms of ensuring that schools continue being safe, the containment measures and more harsh restrictions at the community level must be reinstated, as has been recommended by the medical personnel. And finally, because if we don't do that, I think as a country, we've walked the path. When the first case was reported, as KNUT, we recommended total lockdown of the country. And some people came out to condemn us, that we cannot do that. We must balance between the economy and lives of people. And it is that balancing act that we worked through for the last 7 months, and we are finding ourselves in a more complicated situation, that even the healthcare system is not ready to bear this burden. We are seeing the healthcare personnel reacting and even threatening to strike. If the frontline healthcare personnel in this country and the infrastructure cannot manage, even most of these deaths, they are dying because there are no facilities in hospital for ventilators and ICU beds. And that's a bigger issue.
Thank you, Honorable Sossion, for that. Let me allow Janet a final word on this. Janet, how do you wrap this up? I'll give you a minute.
Thank you. And I want to wrap this at a very high level of saying that as today the president meets the governors, what we know is that the governors are being invited to sanitize the mess of a messed national leadership. We know that these are county governments that have not been receiving monies in good time, and therefore they are not probably able to sufficiently plan or even how to cap COVID. We also know that the big brother, who is the national government, has not behaved so well with the COVID funds, and therefore the level of responsibility and even the example set by the national government is not so good. And I'm saying that really we must use this forum to call the leadership of this country to order and to really tell them that today we are really appealing to you on behalf of the 17 million children that are home and those that are at school really waiting for leadership, this is your opportunity. And for the sake of those healthcare workers that really putting their lives on the line, we expect the political leadership of this country to respect those people as family men, as children of people. Please let us see respecting COVID-19 protocols. Thank you so much.
Thank you so much. We've had Janet Ouko, an education expert, joining us virtually, and Sylvia Kasanga, nominated senator and chair of the ad hoc committee on the COVID-19 situation in Kenya. Here in studio, we have had Wilson Sossion, SecGen, Kenya National Union of Teachers, and Chibanzi Mwachonda, SecGen, KMPDU, joining us for a discussion that will carry on throughout the course of the day, as at 10:30, President Uhuru Kenyatta holds that extraordinary session with the governors to discuss the country's COVID-19 current situation, what needs to be done, have any mistakes been made. Hopefully a real discussion will be had on what needs to be done moving forward to ensure that the situation does not get out of hand. Keep it Citizen TV. We'll give you updates about this, and we'll take you live to that conference at 10:30, as you know, should it begin at that time, so that you are able to follow that up. But meanwhile, many thanks for staying with Daybreak. Keep it here. We take a quick break. When we come back, I take you back to the United States. A lot has happened over the last 1 hour in terms of the Electoral College vote there. Close race there, locked in a tight battle for the White House, Trump and Biden. We'll tell you more about that. And we also have a Wednesday workout after this short break. We'll be right back. Stay with us.